Welcome to Masters of Health, everyone. I'm so glad you could join us. I know some people are like filtering in the room. We're like 4 minutes late, but that's okay. We're here. So we have a new guest, as usual. Every week we try to have a new guest to highlight different careers in public health. Now that may mean that you haven't necessarily taken the career path of an MPH, but you find yourself definitely on the cusp of dealing with issues in public health. So today, I'm so excited. We have our guest, Miss Natasha Phelps.
Hey, hi everyone.
So Natasha, tell us about yourself. Like, what do you do? What's your profession?
Yes, so in short, I'm a lawyer, but I used to be a litigator. I say I'm a reformed litigator turned public interest attorney. So I work in the policy arena. So I used to be in the courtroom. Now I'm really, behind the scenes of all the policy work that goes on at different levels, tribal, federal, state, and local.
What do you
For
mean?
public health, for public health.
Right. What do you mean like reformed litigator? Explain that.
Right. Well, I feel like if there are any lawyers on here, please, if you're a lawyer, please comment. But I worked at a private firm, and it's just the experience of being a litigator. It either puts you in a mindset or you go through things that I feel like the word reformed is is very telling about what that means. So I used to love that. I used to love to litigate, but now I feel like I have changed my tune and found my home in public health policy. So
Okay. Mm-hmm. All right. And so, like I said, it's about how you touch public health. So, you kind of touched on my next question, which is what area of health do you work in, or what your business is in? So, let's go a little bit into how you as a lawyer, a reformed litigator, as a lawyer, how you touch on public health. What are some of those examples?
Yeah, so for the most part, I work in the commercial tobacco arena. So we're talking about, tobacco products that were manufactured for profit and cause death and disease. So I work in policy in that arena for the most part. But then I am able to, obviously, in public health, because we understand the social determinants of health and how many things just kind of interact with each other, it's really impossible to work in one specific area of public health without also working in or being at least aware of other practice areas within public health. So I am specializing in commercial tobacco, but I am also, a public health law generalist at the same time for those reasons that I mentioned. And then I also, at my where I work at the Public Health Law Center, which is a nonprofit, I also lead our race and health equity work, which includes our racism as a public health crisis work. So it is so broad. But then it's also very specific depending on, what I'm working on, which typically is tobacco. So
right. Yeah. And I'm sure because we talked, and Natasha has been on the True Health Live podcast, and we've talked about the tobacco, and the piece that's happening with tobacco right now definitely intersects with the racial health equity, and menthol. And maybe we'll get into a little bit later, but we want to learn about you right now. So, this one is a little different. Usually I ask people what are the job sites in your profession? But normally if you're, but if you're a lawyer, it's not necessarily going to be a hospital or whatever. But have there been interesting places that you've had to go and visit? Maybe not be stationed permanently, but what have been some interesting spaces that you've had to go and visit or be kind of sitting at, in order to do, your job, or be effective at whatever project you're working on?
Yeah, well, I think if you are interested in being a lawyer, but you also want to do public health, there are so many options. There are so many unique job opportunities in this field in public health law. That is, you really probably can't find too much of that in other practice areas, just because of in other areas of law, you do have to, be up on science and things like that. But public health is its own unique kind of field because, like I said, there is so much interaction with social services and government and all of this stuff. So, you mentioned a hospital. Well, if you're interested in healthcare law, or if you're interested in public health law, you can be a lawyer and be advising hospitals on their own internal policies. Right. You could be advising them on their work with the external communities, because a lot of hospitals and healthcare systems, get involved in the work that we do. So like an interesting place that I have gone to, like I often am going when, before the pandemic, I was often going to clinics, like community health clinics, for a coalition meeting, I'm sorry. Or I would, I could go to a hospital too, just to have these discussions about, a policy that they want to pass, or getting them involved in community activism that's already going on surrounding a specific policy. But then I'll also go to things like, in policy, there's all these different stages. You go from research to, policy identification solution to advocacy. So at any point, I could be in different places. And just for somebody who's like, I want to be a lawyer, I don't want to be in the courtroom, but I also kind of want to do policy. If you were, depending on what type of job you have, you could be in the courtroom. You could be, defending or proactively suing for the benefit of public health. So it can just look so different. And I think that it's such a small community. A lot of people don't understand like what that could look like to be a JD and work in public health, or be a JD and PH and have that dual degree.
Yeah, because you technically, like, you could be general counsel for
right.
or like a nonprofit, and that's definitely related. I wanted to ask you, like, I know you said like you're a reformed litigator, but I wanted to ask you, like, how did you choose this path? Like, what was your career path into becoming a lawyer?
When I was younger, I really wanted to do civil rights litigation. Like, I was really inspired by Thurgood Marshall, and just the work that was being done by the NAACP, the Legal Defense Fund. I thought that I would be, uncovering cold cases of lynchings down, across the country, and I would be bringing things to justice that had been ignored. Those were the type of things that I was really interested in doing. And then when I got to law school, my first kind of like dipping my, I'm sorry, I cannot find this cell phone. My first kind of foray into the idea of civil rights was to do criminal law. And so I worked at the public defender's office, and I did criminal defense work, and and I thought, yeah, this is similar, right? This is very similar to the work that I was talking about doing, but it just broke my heart every day to go into the jail or and just really felt like I was just a part of the machine. Because I was really young too at the time. Now I feel like maybe it would be a little bit different, because as an attorney, especially if you're an attorney of color, to come into a courtroom and think that you can go in there and be like, we're going to shake things up, and you just graduated. I think a lot of people do who either they themselves or their family or their friends, or they work in the legal system. But when you're in a courtroom, especially a criminal courtroom, it feels like it's a force, and you really have to be strong enough to be very clear about what it is that you're advocating for. And at that time, when I was that young, I didn't have that. And so I was like, I know this is not for me. If not this, then what else? And I just happened to have an opportunity to interview with this law firm. And so I went I went and did, the private firm life, which was very much like, very toxic, but very fast paced, working all the time, just everything that you think of when you think of a law firm. And it was, I learned a lot, but it was really hard. And so I was really wanting to, and I didn't feel good about the work that I was doing. And so I wanted to go back, to find my way back.
Yeah.
And when I started to kind of look for what that could look like, because I wasn't sure, I saw that the Public Health Law Center was hiring. So it wasn't like I went to seek out public health, but I had civil rights and equity in my vision. And when I read about the position and what the public health really is about, and I had an understanding, obviously, but I wasn't thinking about it how I could contribute to that, practice, to that field. So, but once I was exposed to it, I was like, oh yeah, okay, this can really work. And it really has. I really feel like it's like a really good balance of all the things I care about in a career.
Yeah. So. That's good. That's so amazing. It's interesting. Like, once upon a time, in a long, long time ago days, I thought that I wanted to do law as well. And I was just like, contemplating, like, well, number one, because I did not realize until it was too late that I could do an MPH-JD. And I was just,
Mm,
get out of here. I can't do it. I just gotta get to work, gotta get to do.
yeah,
And
that's disappointing.
and I didn't realize. And then, like, when I kind of fell into advocacy work, it was like, oh well, you can do it, but then someone else was like, yeah, but we're doing it. Like, it's like,
Yes,
so
yes,
yeah,
yes,
doing it, really, you can just, like, talk with the lawyer, like,
yes, yes.
so it's just like, okay, well, that's fine too. And but it also made me remember, like, when I was at that point, before grad school, or I think it was like during grad school. I might have been like home on vacation or something, and I was just like, and my mom, she's retired now, but she was a legal secretary, so she
Mm,
worked in law firms since I was little. Like, I've never known her to do anything else, and
mhm,
so it wasn't uncommon for me to, like, be in a lawyer's office, and, like, kind of, when you go to work with mom, and when you're younger,
mhm.
like, her boss actually helped me write my college essay when I was younger, and, like, so
Okay,
you kind of learn how to, like, navigate that world. And I remember, like, as I got older and I was, like, on break and I was in grad school, I was saying to one of the attorneys that she worked for, and I was like, yeah, I think I might want to go to law school. I just don't know what I want to practice. And I remember he just kind of looked at me and was like, make sure
don't do it.
you want to do.
Yes. I'm like, that's pretty much my reaction. Or that was my reaction before.
Mm-hmm. And I think it's like, but it was so funny. But he liked being a lawyer, but I think he wanted to share and be very upfront about, like, what to expect. It's hard work. Like, I'm sure, like, in any profession, like, you have different tracks and arenas that are, like, a little bit less involved or easier than others. But, like, I think he really was sharing, like, it's not an easy road. Like, be prepared to, like, do work, but also, like, you have to really want to do this. Like, in any job or in any career, like, you have to like it. So, like, and it's kind of like, to your story, like, you weren't really, like, happy about what you were doing, so it's like, let me maneuver and figure out
Hmm.
what's great. And it's so awesome that you ended up finding, like, that sweet spot in, like, law and health. So I was like,
Hmm.
oh, that's so good. I was like, you got to come on the show and share.
Yes. Well, let me say, I feel very honored because I've heard that, if you're not an MPH, you don't often make it onto your show. So I feel very special, and I hope that I have some information that's, interesting to your online family. So yeah, no, I think, I thought about, on the opposite spectrum, I've thought, do I need to go get my MPH? So, like, just know that feeling is, like, mutual in our practice field, where it's like, what are the limitations of my expertise because I'm not an MPH versus me being a lawyer. And I honestly think that both of us can both know as, like, a lot and as much as we need to know about each other's, like, expertise
Yes.
areas, but it's more about how our brain approaches things
Yes.
that I think is, like, do you need to, have both? I don't know. It's certain, I can definitely see it with, even with some of my coworkers that are MPH JDs. I see that it's beneficial, but there's nothing that, like, I feel like you would need to go get your JD if the only reason you were going to get it is because you thought that it would help you do your job better. I think it's just
Yeah.
more about, like, and like, what people think about what you're saying.
Yeah.
Just if you did a litigation update, they might say, like, okay, okay,
There will be some, like, head scratching, like,
yeah, but at
and
the same time,
why?
I'm not going to go do, like, I'm not going to do a summary of data collection that happened,
Right.
with this, that the state went over, in last year. That's not my,
Right.
my
Right.
forte. But,
Right.
but it's like, I don't think, for me, the decision to, like, not do that, to, like, not go back to school, or to, even to just decide to move forward in public health without an MPH, is this idea of, like, do I like the idea of going back to school? Number one. Because I think school in general is difficult. If you've like for me, I went straight through. Like I was like, K through 8, high school, college, law school,
Yeah.
on to my career. The
Yeah.
idea, and I teach. Oh, right. Okay, so you get it. It's like you're like, you're done with school.
Yeah.
But I do teach on the side, and I just, I hate grading. Like I hate it so much. So I know I would still hate to do schoolwork because I don't like to assess schoolwork. Like I'm not even the one creating this stuff. I'm being the editor. And I feel like if you don't even like to edit that work, like how are you going to want to do that again? So I don't know. For me, I'm like, I don't know if I would enjoy it. And then do I think it's necessary for what I'm doing? No, because I work with really great people all the time. And I know I can always ask for help. And that I'm going to do my work based on what I know is available.
Yeah.
You know?
And then the good part is that it's like you said, what will happen is if you find yourself in that arena, you will always be kind of mixed with individuals who have the expertise or the skill set that you don't. So like, right, I wouldn't go and talk about litigation or be like, in the courtroom. But what I can do is talk about like maybe policies and bills that are on the docket,
Right.
and maybe there won't be that very technical breakdown, but what it means for advocacy's sake and public health. And then you come in and say, and this is how we're going to attack it, right?
Right.
Or like the lawyer, you said, you don't have to come in and say like, well, we should do X, Y, Z. We should, grab these, this group of people and partner with. No, the public health advocacy community organizer person is going to be the one to help with that. So like, this is the exact reason why I was just like, everybody doesn't have to have an MPH. I think if your career touches on health, or public health, it's important to showcase it because it gives people a glimpse in all the possibilities that they can have.
Yes.
So you might have that person who was like me, who is, fresh out of school, like getting their MPH or like about to come out, and they're like, should I get my JD, or should I stay a little longer so I can do a dual program? You don't necessarily have to. And also think about the pockets. You don't necessarily.
Right.
There are ways to like do this. And like I said, like, I had to be reminded like, yeah, but you're already doing it. You're effective.
Yes.
So, and not necessarily having the JD. It's all about like the coalition and like kind of how to, which path you want to utilize so that you can like kind of use the degree to the fullest. So
absolutely. And I think the main thing about public health that I think most of us understand is that it is a type of practice where we all know there has to be collaboration. It has to be the only way to actually effectively make change. I'm not saying that this is how public health is always done, and certainly not the way it's always been, but like the idea that it takes a village to really, do something that you all want to achieve. And so, that's what we're talking about when we're talking about, health equity and people able, to actually achieve their highest possible health level is like, we need to be able to bring people in who are most impacted. Like there is no way that you could possibly, what I'm saying is there's no way you could possibly be an expert in everything that's within the umbrella of public health. So like if if it starts with, oh, should I get an MPH, then you really, why stop there when you can, should I go get community organizing training? Should I go do, it's just like, there's a lot that comes into public health, and healthcare in general. So it's really about that mindset that like, I can't do everything. But being in public health is knowing who to talk to, knowing who to connect with, who to bring to the table, all of that stuff, is a part of like that interdisciplinary practice that I really like as a person who enjoys like having a vision and all working together like towards a vision.
Yeah. I'm just going to take a brief pause and just welcome and say greetings to everyone in the chat. Peace, Ima Precious. Peace, Naya. Peace Kashia, top tier speakers, Brother Antonio. So glad you could all make it. And hello to all of you too who might be catching this video later. Make sure you like, share, and subscribe, and leave any comments below. If there are any questions, just a quick recap. We do have Natasha Phelps here. She is an attorney, a lead attorney at the Public Health Law Center. So if you have questions about law, she did used to be a litigator, but like I said before, she performed. So, and now she does most of her work in public health and tobacco, which I'll ask a question about. But first, I want to know, like, if you could tell us, like, about a day in the life of. So, give us an example of what your day looks like, an average day.
Okay.
You can do a pre-COVID and current COVID.
Okay. There are so many variations because one of the things I actually like about being a public health lawyer is nothing is ever the same. Like you're working, you could be working on different issues, multiple issues, different issues every day. Like basically, let's say on a typical day, I wake up. I have a lot of meetings. I meet with people a lot, whether it's internal meetings or external meetings. There's a lot of conversation happening. So I know, like, for a lot of lawyers, depending on your practice, you can hole up in your office and just take care of business on your own. Mm-hmm. Public health law, doing any type of public policy, as a lawyer, you're going to be engaging in a lot of conversation. And it's not just you talking. A lot of it is like, I'm here to listen, take in what you're saying. Yeah. And, so there's a lot of that. But a typical day, I might have a meeting in the morning. But let's just say I might get a question that comes in that asks me about, whether a jurisdiction is in whether the city of El Paso in Texas is preempted from being able to pass this type of policy. Mm-hmm. Can we have a call to discuss? And, this is eventually what we want to do with it. So, I would maybe that day I would look into it really, really briefly, the legal issue. And then we would create an action plan based on what they told me. So if they told me like they're actively working on a policy that they want to introduce, then, it's like, I'm getting on the call to strategize with them what to do from here. If this is just kind of like a hypothetical question, like, well, could we do this if we wanted to? We might bring in other people, other partners, this whole community like engagement piece where we're like, yeah, let's bring in this organization because you still need help with the community engagement piece. Like, you're still there, so it's like that. A lot of my job is figuring out who to bring in and who can be most helpful. And then pre-COVID, I do a lot of presentations. So I travel a lot as a part of my job, which is definitely a perk, for those who like to travel. Mm-hmm. I always take a little vacation out of every little trip. So, I could be doing a presentation in, I keep thinking about El Paso. I don't know why I keep thinking about El Paso, but what?
I said, maybe you're supposed to go to Texas. What do they say? The stars at night? Oh,
yeah.
Right?
I loved it. I have to say, I really loved El Paso, though. So maybe I'm missing it or something. But all over the place. I will do a presentation either at a conference, or if there's like a coalition or a state or local health department that wants me to present on something, I would be doing that. And then maybe in my spare time with the rest of the day, I would, we get contacted by jurisdictions or organizations like, either national groups or community groups that are trying to work on policy, and they ask for sample language. So I'll draft the sample language for them to consider. For state, we'll do that for state level too. So, drafting law basically. Yeah. And then, once in a while, like I said, some litigation is something that we all also touch. And so, we might be working with a law firm that is representing a jurisdiction or an organization in court, and then we're helping them with their defense, but we're not representing that. Yeah. That person, like once removed. So that would be kind of like, I guess, like a day with a lot of variety. Mm-hmm.
Mm-hmm. So I haven't necessarily talked about menthol on this show. So I want to give people a little bit of insight into that, because I know that's kind of where we started off. It's like, can you come on? We were on the same, it was like a coalition call, and you were talking about it. I was like, yeah, I'm just going to ask her to come on the podcast. And I don't have to be the one.
Yes. I had so much fun, by the way. That was so much fun.
Oh, good. I'm so glad. So let's tell everybody about what's happening. As we can use that. We don't have to go to El Paso. We can use an example of a day in the life, what's happening now.
Okay. So just as a backgrounder for those of you who don't know, so in under the public health umbrella is the commercial tobacco world. So there are all these things that cause chronic disease and death, and under the public health umbrella of like prevention, chronic disease prevention, for example. And so tobacco is like one of those, many buckets. And so within that, the product of menthol flavored cigarettes, which I'm sure a lot of it's a huge part of the tobacco industry's marketing scheme, because they make a lot of money off of menthol. It is a huge equity issue within commercial tobacco. And it is a reflection of equity issues in general in commercial tobacco, and a reflection of inequity issues in anything across the United States. And the reason for that is because the tobacco industry back in the 1950s, they identified young Black men as the trendsetters of consumerism in this country. So the tobacco industry had so much money early on that they were really ahead of other industries in that consumer research and marketing research. They were ahead of the game early, because at that time they also were discovering, but not sharing with anybody else, how addictive their products were. So they're like, we need to get as many people addicted as possible, because they also know that their consumers die earlier than you would expect for the average life expectancy for other consumers, that not based on the use of your products. So like, they know that all of their consumers, if they are addicted throughout their lifetime, that they will have a shorter life. Like that is on average, you have a shorter life expectancy if you consume or become addicted to nicotine. And so they knew they had to hook people young, and they needed to hook people that they knew that they could really target with their marketing, because they also saw how effective it was to market in the way that they were. And so when they saw that the young Black male consumer was a trendsetter for consumerism, they started to do a lot of market research on the Black community and really, really figure out what it is to make a product something that a community would like almost embrace. Like that was their goal for this product, for this to be a Black product. That was their goal. And so you look at even their own documents, like they have research that shows when they would go into they would go into Harlem in like the 1970s, or maybe it was 80s. I don't remember what project this was, but they called it like Project Ghetto. So they're kind of like the most insidious, awful type people who also are doing these things that make it seem like they're caring about the Black community. They're caring about, oh yeah, like here's some money for the cool jazz festival, because we believe that jazz should be preserved. We believe in, having, African American cultural and music preservation. Like, they're saying these things that they know are going to be received. And in the meantime, they're making menthol cigarettes cheaper than any other areas where there's a high percentage of especially low socioeconomic Black youth. And so they were just this multiple marketing scheme with menthol, so that they could solidify this consumer base and generations of addiction. And so when it comes to menthol in commercial tobacco, you're really talking about like how the tobacco industry thrives with systemic oppression, because the less political power you have, the less energy you have, because you are oppressed in all these other different ways. But then you're like working all the time. So you can't go to the city council meeting when they're there to talk about what to do about tobacco, or what you're not going to go bring it upon yourself to go find and contact your representative and push the issue that so many politicians don't like to touch because of how powerful the tobacco industry is. Like, it's just a lot of work. And so they have always seen people who are vulnerable, children in general, and targeted them. So, when they first started handing out free samples of cigarettes, one of the first groups that they targeted were the projects on the East Coast, housing projects on the East Coast. So like putting free cigarettes on every doorknob in some of the housing projects, low-income housing projects in New Jersey, in New York, in Philadelphia, all these places where kids were, running around and, you know, playing. And then also, you know, on the playground, they were them giving them out at the playground. So it's just like, now it's a part of what so many people know to be a part of their life in positive ways for themselves, but then also negative ways as well. So it's like the idea of menthol is about getting the industry to stop being able to produce these products, stopping them from being able to target certain communities that they feel are vulnerable and disposable, because, you know, those are the consumers they want to hook, and they don't care if they die. So it's a really big equity issue in tobacco. Menthol cigarettes are, and there's so much talk about it, but it's not something. It's like people know a lot about it, but at the same time don't, you know. So.
Right. Yeah, I remember like growing up, like once my father came home from, I don't know where, but it was some concert or some free thing in nearby, and he came back with like paraphernalia, and it was, you know, promos and giveaways that they had, and it was like Newport, like all over, you know. So, and I remember those also, like, you know, looking at the magazines, and this point about the we believe in preserving jazz and Black culture and da da da. You know, they were some of the first companies that would use melanated models, and so you're moving in this space, and it's like you don't see reflections of yourself in media and commercial spaces. When you see something, it's like it's finally us. You don't necessarily, like, at that time, you know, necessarily stopping to say like this is not healthy, because the only connection is, oh, auntie so and so smokes, or uncle so and so, or grandma. It just becomes something that, you know there's like you can make a connection to it, but the connection is not, this is unhealthy, you know. It's just so crazy, because like, you know, it's like you said, like about like the using the product. It is the one product that, you know, when used as directed, it most likely will kill you or make you sick. And that's not what they talk about. And that's why it's so, you know, horrible. And what I will add, like I was at like an event once, and this was recent, like within the last like several years. So maybe not that recent, but it was recent enough. You know, based on what's
if it was pre-COVID, it was yesterday. Like,
yeah, right. It was, because it seems like it was so long ago.
Yeah.
And this was like, you know, some years ago, but not too long. It was while the menthol thing was happening, and I went to this conference. It was in New York City, and it was being sponsored. It was the annual conference of a very well-known and particular activist group that is, I will say, is run by someone who may or may not be an influential man of the cloth. I'll say it like that.
Yes.
And I went there, and we were like doing like some covert operations. And you could see, like, you know, most times you go to a conference, it has like you have like the guide, you know, like what sessions are going on, what time, when there's a plenary, you know, who's talking, whatever. And then there's also like a section for ads in the back. And it was like riddled with ads from a very major tobacco company. They actually were one of the major sponsors. And they had like a session at the very close of the conference, and it was under the guise of like keeping young people from smoking. And I was like, that's rich. Like, you are the tobacco company, and you're talking about a program that you have to keep people from smoking. And it was so disgusting how they were like, and I'm like, I can't even believe the people that are sitting here are confused by this. But then I was like, maybe they're not confused. Maybe they're paid. And it was just like so interesting to like sit. And when you're in spaces like that, you have to take stock of the room. And when I made sure I looked toward the back, lo and behold, there's the handler.
Yes.
Back, making sure that everything that needed to be said was said. And he was from the tobacco company. So like, and if you're paying attention when they're having hearings and things, you know when they're sitting in the back, very inconspicuous, and just listening to what's going on so they can make their next move. It's insidious. It is so insidious.
So insidious. And, you know, it's like, that's what the tobacco industry does. They make everything more difficult. You know, they say like racism is such a distraction. And that is what the industry does. It distracts with all these, like, they appropriate arguments that are actually real, but they actually don't have anything to do with what they're saying. It's misinformation. the tobacco industry has been spreading misinformation for decades. They're convicted racketeers. Like, they actually were convicted in federal court
Right.
of violating federal RICO laws. They lied to the public about knowing that their products were addictive when they knew it, you know, a long time before even the scientific community. They had already been known that their products were causing serious addiction, that they kill people, that they cause chronic disease. They knew all of that before everybody else. And what did they do? Did they share that information? Did they stop producing their products? No. They developed ways to make them more addictive, to make them more palatable. Let's add flavor. Let's add this. Let's add that. Let's add formaldehyde. Let's use this type of filter that, makes somebody really suck in a lot of air but not take in, and the cigarette burns quickly, but they're, only getting this amount of nicotine so that they buy or they use more sticks. Like, this is what the industry is doing while, they're knowing that their products will kill. They just saw a huge money opportunity and they pounced on it. And since that time, because they've lost their credibility, because they've been, there's been a congressional hearing that put them on blast, or they were sued, or, their internal documents revealed that they lie about everything. They're like, oh, wait, okay, we need someone who has the trust of the communities that have now seen what we're about. So they're very good, because remember, like I said, and I know you know this, but it's like they are the OG target market industry. Like what we see all these other industries doing now, tech and everything that we see, that I guarantee you there's a lot of the tobacco industry playbook that these industries.
Oh yeah. I think like they were the first ones to really use psychology.
Yes.
Marketing. But you're right. No, they wrote the playbook on like the psychological marketing. They definitely did.
Yes, and like you mentioned with the models, it's like it is not just, oh my gosh, look, oh my gosh, there's a Black person in my ad. Oh, it's a Black couple. Oh, and it's not just a Black couple, they are Black power. The message is about, during like the 70s, for example.
Afros and
yes, afros, very Afrocentric messaging. Yes. And so it was like, and it was very anti-establishment. Like, they just were really trying to get to these things that were very real issues in the heart and mind of African Americans, and just exploiting that. And then now they're in this place where they're like, let's confuse them. They think that this is theirs. We're going to confuse them. We're going to, pay so-and-so and so-and-so and so-and-so to say this, this, and that. And either it will scare them or it will confuse them so much that they're just like, I don't know. I just think we should leave it. I mean, you know what I mean? Like, that distraction is the name of their game, and I think they were doing this even before menthol.
Yeah.
Like, it's not just about menthol, obviously, but menthol is the best example. And that's why, you brought up menthol when we started talking about tobacco, because that is like such an important issue.
Yeah. And distraction is the name of the game for these. Like, it is the name of the game. Every time you click the channel, put on your device, it's like something is being thrown in your face to keep you, distracted from what is really happening. And there are no exceptions. They are, probably, they probably started it all, like,
right.
But experts at it. They're experts. There was a question in the chat, and I want to just make sure I get to it. Sham the Joy asked whether the life expectancy of Caucasian males that consume nicotine are the same as Black males who consume nicotine. And I would say, like, that's really like a research question, and I don't know the answer off the top. But what I will say, when we're talking about menthol, we do know that Black people, melanated people, I'll say, because there's something I want to add to that. Melanated people do consume mentholated nicotine more than any other ethnicity, and then followed by Latinx communities. And within the melanated, or people who identify as African American, it's actually the women who smoke more. At least that's the case, like, especially like in New York, they have higher rates of menthol tobacco products use among women who identify as Black or African American. So that is a really big thing. And then we know when it comes to like what happens with tobacco, and people who are diagnosed with lung cancer. Um, Black and brown people are diagnosed at higher rates, and they have less of a chance of survival because a lot of the times with many things it gets diagnosed at a later date, because there's also that there's not that access to like preventative medicine, and not just access. We're going to be real, we like to be honest on this show. It's also, you know, we know that melanated people don't go to the doctor as often. Like, yes, there's an access issue, but we also know they don't go to the doctor as often. And there is a culture of like using the emergency room, like, you know, doing urgent care and not necessarily having like steady preventative medicine. So
Right.
when they're diagnosed with certain diseases, they're often worse off than their white counterparts, and that is the actual fact. But we can get back to you. If you put your question in the comments, and I'll definitely get back to you with that stat. The other piece of why I was wanted to mention about like the nicotine, because your question was about consuming nicotine. One thing that has to be known is that nicotine actually binds to the melanin receptors in your blood cells. And everybody has melanin, but those of us who have more will have a harder time quitting because it's been bonded to, because it bonds very quickly and very easily. So if you're using a product that is mentholated, menthol is mint. And what happens is it anesthetizes, or it numbs the throat, and it makes the harshness, it masks the harshness of the tobacco going down. And it means that you inhale deeper and you smoke longer. So what is happening? That means you're taking even more nicotine. So that's just like an interesting fact. So like when we are, you know, when we know people that we love that smoke, it's like, hey, maybe you didn't know this fun fact.
Right. It is like, it's so crazy. And, you know, I don't know if I had said this in the beginning, but the reason why menthol is like, you know, a Black issue often in the way we talk about it is because 85% of African Americans who smoke report smoking menthol cigarettes. So, you know, what Deidre was saying about the difference of how you hold in, that you take in more, you hold in longer, and, you know, whatever, it explains why then when you look at you know, some data that came out a while back, it was showing that like people who smoke menthol cigarettes try to quit more often than people who do not smoke menthol cigarettes, but have a much lower likelihood of being successful in their attempt to address their nicotine addiction. And so that shows you how difficult it is not only to stop you know, to address a nicotine addiction, but then specifically with menthol. And so, you know, in Deidre, as you're saying all these other things about like care and treatment and prevention and, you know, counseling and all that stuff, it's like, it's so hard to say like, you know, exactly how everything falls into place. And that's like with tobacco, for example, like when you're talking about, you know, white smokers or, you know, people of color who smoke, you are assessing like, you know, how it impacts your body and, you know, how what your smoking behavior looks like based on the type of product and all of that. But then, like you said, Deidre, there's all these other things, all these other determinants of health that can either aggravate whatever condition is you have because of your use of cigarettes, for example, or it can like it can aggravate it, or the commercial tobacco can cause like and aggravate other chronic diseases. So there's like a cyclical thing going on. Like, for example, with COVID, if we know that there's like a higher percentage of, you know, Native Americans who are smoking in the state of Oklahoma, for example. And then we also see a health disparity when it comes to not just COVID infection rates, but COVID hospitalizations and deaths. It's so hard to say, oh, we can say that this is part of this, or the reason for this is because there's a higher smoking rate. Yeah, of course, in part, but then it's all the things that come along with it. Like you said, Deidre, like, have they tried to stop smoking? Have they been smoking for all their lives? Do they have any chronic conditions that is tobacco related? Do they have any chronic conditions that's not tobacco related, but it's aggravated by tobacco? And then you have COVID, and then like it's like a compounding interest of how tobacco use impacts your health, and then how your health will react to you smoking tobacco and tobacco related disease that you might develop. So it's so complicated and frustrating when you think of it that way and tied to all the social determinants of health.
Mm-hmm. Yeah. So I want to circle back to how this is really important when it comes to being a lawyer who is in public health. And so tell us about how that comes into play when it comes to testifying, commenting, what that looks like, because it doesn't mean that you don't end up in some sort of hearing,
Right. Yeah, we're not completely behind the scenes. So, another a good example of somebody like me who just has a little bit of a different job is a lobbyist. So, we talked about working for hospitals. You can be a lobbyist for a hospital and healthcare system. You can be a lobbyist for an organization. You can be the director of policy for an organization. But you can, if your job is based on funding where you are allowed to advocate and lobby, you can be, in the Capitol, trying to push for certain policies. And within that, you'd be responding to questions, you'd be changing language, and it would be more you're involved in the negotiation process. For me, often, if I'm going to a hearing, if I'm going to, be on the stage, I'm often there to give information about how a policy would work and why you want to be really specific with these words. I think people get annoyed with lawyers in public health because it's do you know how hard we work just to get this? Now you want to tell us, no, don't go forward because you use the word the here. It's that type of thing where we're just we just want it to be we want it to be good so that you're not facing problems down the line, or that so when people are trying to comply with this, it's clear. It's that type of thing. So you might be testifying, speaking to the language and why that language was used and what the health impact could be of a policy like this. And so that's when you would obviously be teaming with MPH, PhDs, to come to testify to that piece. But you can say, as a lawyer, the way that this is drafted, the channel that this is going through, we're passing this as a joint resolution because X. We're putting this in the licensing code because X, or whatever it is. You would be explaining that the policy needs to be the way it's presented, or it's not going to be as impactful in the way it's intended to if it's written this way. Often that's what we're talking about. Or we might go over policy options, for city council, if we're invited. It's okay, so you just had your local public health department present on this issue of how a lot of kids in schools have vaping products on them, for example. You presented to the city council that it's a problem, and so I'm here to tell you about some policy solutions to that problem, but that won't create other problems for you. So in public health, it's the response to that issue, for example, is okay, well, some of the school districts would be we are going to expel or suspend all students who are caught with a Juul, without exception, because this is we don't have the resources to deal with this. I'm there to be you're trying to resolve one problem and then creating another. And so it's important that you do it this way, and that's why. So that's kind of that's kind of what I would be doing on this stage.
Yeah. So folks, it's not just I'm just a bill. Okay. It's way more intricate and involved than that. A lot of what Natasha was talking about, what you're talking about, is all those technical behind the scenes. Like you said, it's don't use the word the here because da 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 da. It's not some congressperson or elected or council member just kind of sat in their office and wrote up a law. They actually, go reach out to people like Natasha, hey, this is what I want to do. And then the language is drafted, or, and they, kind of pull in people who are the public health advocates or the lobby. Right. And that becomes, it's almost like a little coalition that helps to write and, clarify laws. And then it goes through the kind of legal process that is way deeper than just a bill on Capitol Hill. Then it goes through being codified, who makes the rules, da 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 da. And so it's really interesting. This is why, to your point earlier, we have to be very aware and cognizant of what things are being passed, because by law, they do have to tell us. And so a lot of times, these things will be on if it's federal, it'll be on the Federal Register. Many times there are things where, there has to be a commenting period, but they'll keep it low key. Nobody will say anything, and these things slip through the cracks. Or if it's something that has
Yes.
a ballot, because one of my guests, like on I think it was one of my guests on the podcast, it's like, oh, we're just gonna wait for the big election, and people are not necessarily reading questions that come on the ballot. They're not necessarily understanding like the language that's used, because there wasn't like this, kind of understanding of like, oh, I had time to comment, I had time to add my 2 cents, and da 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 da. And a lot of times, because they're banking on, especially when you're in underserved neighborhoods and vulnerable neighborhoods, nobody necessarily has the time, because like people are like working like crazy hour jobs, or they don't necessarily have the access to get someplace. There's childcare issues, and it's not to say that people in many spaces don't have this, but it is exacerbated and more present in underserved communities. That's why they're underserved.
Right, exactly. And I think that that's what, so many, obviously that's something that a lot of areas, industries, all of that have all long taken advantage of that. Like what the tobacco industry did. I mean, they're so clever in the way that they, have seen 20 years ahead, and what they're going to do. One thing that they did was like with that thing where it's like, let's just sneak it in here in something that looks completely unrelated to what is actually being passed, but we're going to put this just one little sentence here and hope nobody sees it. And sometimes you don't. But the industry, what they did was, let's preempt local communities from being able to do things, so let's get some language like, oh, okay, well, so for example, if there is a plastic or environmental bill or something like that, they might put something at the end of it, or just like somewhere in the notes, that it will also amend a chapter related to tobacco, and it will preempt any local action on product sales. And it'll be so broad and so general that it, like, you could just look and you don't see the word tobacco, you don't see anything, you don't see cigarettes, you don't see anything like that, and so you kind of miss it. But then, like, what happens then is a community's like been working on doing something. Oh, we're gonna pass this, this local tax for cessation or something like that. And then all of a sudden you have a city attorney or some attorney who will be like, wait, I think we're preempted by this. And by that time, it's like, it's too late. So then the community has to either decide to give up, or they decide to move forward, but they know it's going to be a fight, because the industry will fight hard to get you to not be able to sue them. And it's like, so then where do you go? Like, the legislature, there's people who are bought out. It's a difficult process, all the things that you said. And then you try to sue them, and they're like objecting to every single thing, putting in motion after motion. It's too expensive to sue. So it's like, they really know what they're doing to try to take it out of your hands.
They wear you down.
They wear you down,
because they have the it's not even about being like politically savvy. They just have the money to do it.
Right.
And so, like, if you have like the time and the space and the opportunity, or you put yourself in a place where it's like, no, I got time for this, you can get them, because they've been gotten before when they were, that's where we got what was called the Master Settlement Agreement, which was in 1998, so they've been gotten before. It honestly, it probably just made a small dent in the coffer, but it was enough to be able to create funds that do go through, programs that do provide like nicotine replacement therapy for people, and like, advocacy and education around tobacco control. So there's another question in the chat, but before we get to that, can you just quickly give like a little explanation as to what preempting is?
Oh, sure. So preemption is when one level of government, that's like what you would consider a higher level of government, tells a lower level of government that it can't do something because they're handling it. So like it's kind of a complicated theory, but the idea is like, some people look at it and say, oh, well, preemption can be protective. Like, for example, if you say, no local government can set a sentencing guideline that is above X many years for these specific crimes.
Mm-hmm.
Like, that's like to try to address equity, right? But the problem is that's not actually how preemption happens in practice. Like in practice, preemption is used to prevent local governments from being able to pass regulations that are protective of the public interest. So like, for example, there are preemption laws that a lot of preemption laws are in the South, it's ironic because they're more conservative, but yet there's less local power by the conservative politicians that put these preemption measures into place. But southern states, and then like Wisconsin's fairly preempted. I mean, there's like sprinkles of different places. Minnesota, for example, is not preempted for a lot of things, and so that's why you see a lot of like local action happening in a place like Minnesota or California. But we're starting to see preemption. Preemption started with the tobacco industry, and then got brought up by like other industries like gas and oil, even like the restaurant industry, like food and beverage. A lot of with the gas and oils, you'll see it a lot with like minimum wage and environmental regulations. Like, so at a state level, they'll say you can't pass any local minimum wages. So that's something that happens, or even with COVID.
Yeah.
So you're seeing a lot, like with Governor DeSantis in Florida, trying to preempt local communities in Florida from establishing a mask mandate. That's a very current example of what preemption looks like in practice. So yeah, I hope that.
Yeah, thank you. Yeah. So we have a question in the chat, and then we'll do one last question. So okay. Shannon Joy says, other than traveling, how has your position changed since the pandemic?
Oh, good question. Other than traveling, I think, a part of my job is, really working, with groups and organizations. So just not being around people. Obviously I'm zoomed out because the amount of times I'm in person with people, I'm just on Zoom, which is like, I guess that's not unique to me. I'm trying to think how else. Oh, one way in which it's changed, just because I am in public health and because I specialize in tobacco, since COVID, you've now had to fight back against, I think, misinformation in general, but specifically people saying like, we don't have time to work on tobacco right now. Like, your community priorities change.
Yes.
When certain things happen. Yeah. And you understand it, of course, but then you're also like, wait, but don't you understand that this is like a pulmonary infectious disease, and like we got to work on tobacco because this is like blah, blah, blah. But really it's about being creative and being able to say like, oh, well, if you don't want to talk about tobacco right now, you want to talk about COVID, we can talk about COVID. And I'll tell you how tobacco, like what we can do together on COVID that will also work for tobacco. Or, oh, you're concerned about environmental regulation. Perfect. I can tell you why you should support this tobacco policy thing, because you're trying to get at reducing plastic pollution. Like there are so many ways in which you can bring subject matter areas together, even outside of public health. You want to talk about elder care, you want to talk about housing. There's so many things. I think during COVID, what's really been shown is you have to be creative to show that there is this cross issue coalition work that can happen and policy discussion that needs to happen, so that you are like packing a punch with the very limited resources and time that we all have.
Yeah. Yes. Thank you so much. Shannon Joy, I hope that answers your question. Yes. So it's two last questions. So actually, no, one last question. What advice do you have for someone who's an aspiring like public health person who is thinking about, they're sitting on that cusp between public health and public health law, like trying to figure out what they should do?
I would say, well, first of all, I would say you can reach out to me if you want. Please do. I'd be happy to talk to you more and answer specific questions that you have. But I would say maybe just do a little bit of research. One thing about public health, and I know you know this, Deidre, that like our resources are all over the internet. Like, so if you, even Public Health Law Center, if you just went and looked at some of our archived webinars, or, are you on YouTube, you can find us at different conferences just to see like what we're talking about, how we're talking about it. Like, because if you like that, if you like the way we talk about things, if you like the way we frame things, then you might want to go into the law, because the one thing that law school does, I think there's a lot that can be cut out of law school. I think there's a lot of problems with law school, but one thing it does do is it shapes your brain to think a specific way before, during, and after engaging on an issue. And so the way that we kind of approach things is unique in a sense, because we're thinking about all the things that could go wrong, all the things that has gone wrong, and all the things that are happening in this moment that is really about practicality. Like, so it's a very unique way of thinking. If you're more of a thinker, like, or if you would like to practice skills, to have that type of logical thinking, which we all have, but it's like, it's just about, the way, the scope in which, how you can see it. Then explore it. I don't think that anybody should go into debt to go to law school. Personally, just my opinion. So find some programs that you think are maybe going to get you at least a substantial scholarship. See if that's available to you, and then really think about, what do I want to do? Because if you want to do something that is going to allow you to do something like go to court, then obviously you can't just be an MPH. You also need to go to law school. So, if there are things that only a lawyer can do, then obviously you should go to law school. But I think that a lot of people think that being a lawyer means that you're just, more than other people. And that's absolutely untrue. It just means that you're coming at it from a different approach. So don't think you have to get a JD because you want to rise up to the top in public health. Not at all. Not at all. Not at all. So, just think about who you are and what you like, and then think about for what you want for your career, if you want the type of pressure. And I'm sorry, Deidre, I'm forgetting one thing you had asked me earlier was, like, what is it like to be like a JD in public health? And I would just say people's expectation of what you're bringing every time you're in a space. Like, there is something, because people call lawyers either when something bad has happened, or they did, like, something bad already happened, or something bad's about to happen, or they really have been working hard on something and they want you to see it through. So there's a lot of pressure in that, but I think that is true for many other careers. But I did just want to mention that is something that's very particular. Some people expect you to carry a lot of things through with your mind. It's like, so there's a lot of pressure.
Okay. So thank you so much for answering that question. So I'm so glad that you were able to take time to come on the show, because I think it's really important to show that where, there's definitely touch points with public health and different careers. And I was I wanted to make sure I went over health law and policy and things like that, because that's definitely one of the things that we highlighted. For those of you who don't know, sometimes I refer, we came to this point by, check out on deidresully.com, the blog post, what careers can I do in public health? And there's such a list of all the different career paths you can take in, the different kind of positions, examples of positions under them. And health law was one that I was I need to have somebody to check off so they can see what that looks like in practice and hear that. So thank you so much for coming on, sharing some of your knowledge and expertise, and, being very open about your path and what that meant. Thank you for everyone in the chat for joining in, asking your questions. As always, if you are catching this show afterwards, please feel free to put your comments in the bottom. Natasha, what I'll do is put your LinkedIn information in the description box. So if people have questions or want to reach out to you, if you're a student and you have questions and you're thinking about health law, you can reach out to Natasha. So thank you everyone for joining us, and we will see you next week. And we're interviewing a tobacco program specialist. Peace.
Thank you. Thank you, Deidre.
Thank you.